Doris Greenspun is CEO of the Registered Nurses Association of Ontario. Doris, thanks so much for joining me. She joins me from Toronto this evening. Doris, when you look at the announcement yesterday by the Health Minister and the Long-Term Care Minister, as it relates to hiring 6,000 additional healthcare workers, 2,500 new hospital beds, the RNAO released a statement yesterday, which reads in part that the RNAO believes that the government's 5-point plan to tackle these healthcare system challenges represents an important building block to begin tackling critical issues facing the nursing profession. How confident are you that the government will actually follow through in its pursuit to hire these 6,000 additional healthcare workers and free up 2,500 hospital beds?
So first of all, let me rephrase what you said. We did welcome the government measures as to bolster the profession and address the nursing crisis. We also said that we needed bolder steps, including Bill 124, and I will tell you why, to repeal that bill. And we also, if you remember or may not have seen that part of the release, warned against privatization and said that that will be the line on the sand that we will draw, right? Because nurses work with the goal of helping everybody, and for-profit delivery in corporate status will not allow us to serve everybody well and build the system. So that's number one. The reason that we did say that Bill 124 needs to be gone is because the biggest fear, Wyatt, that we have is that actually we will bring nurses, and even if we bring a good number of them, if the conditions of work are not competitive with other jurisdictions, and we are talking other jurisdictions in Canada, as well as the US, then nurses will use us as a bridge and will go somewhere else, right? And that certainly will be a waste of resources because without nursing, the system crumbles. It's like a person needs a spinal cord to be able to walk. And when the spinal cord is not functioning, the system, cannot do the same. The health system is the same. Nursing is the spinal cord of the system, not only the heart. So there were some good aspects to the announcement. For example, the issue of tackling the internationally educated nurses, 26,000 of them waiting on the sidelines, most of them living already in Canada and wanting to join the workforce, specifically in Ontario, waiting on the sidelines for their papers to be processed, to be registered, instead of on the front lines, which is where we really need them to be. And so we are very pleased that this government is tackling that issue. I would love you, Wyatt, to follow up with Minister Jones. She did ask, as you may remember, from the College of Nurses of Ontario, a report by end of this week. My understanding is that she received the report yesterday. The report should state not only what's the status of INs, but how are we going to, within 6 months, clean the backlog so these colleagues clear up the backlog, so these colleagues are providing care to Ontarians. And we want that report to be public so that we all can work together to remedy the situation. Second, it was very good that they're going to provide $1,500 to support these colleagues in getting their registration. But the biggest hurdle is not for them the money because they have been waiting to work. The biggest hurdle for them is not working, not being at work, because they will make the $1,500 if they were at work. What is really beautiful also is that the government is providing $1,500 to retired nurses to serve as mentors to both nurses that graduate in Ontario, as well as the internationally educated nurses that come already with their schooling, come already with their expertise, but need to acclimatize to Ontario, right? So these retired nurses is like, to me, it's like manna from heaven. It's really good news. The other good news is, and that comes from Minister Calandra, the other ones was for Minister Jones, is the 226 nurse practitioners for long-term care, and the first 75 are already in the budget to be released in the next few weeks, I hope, so they can join the nursing homes in Ontario that desperately need them. And ideally, hopefully, we will have 100. We are asking for 100 per year, and within 5 years, cover all the nursing homes, because we already have about 150 from previous governments in the nursing homes. And this will prevent residents to be transferred to hospitals. So not only it will help hospitals, but most importantly is for the nursing home residents that get very confused when they go to hospitals. Many times they come back with pressure injuries because in a hospital, top priorities are more urgent things. So not always, as nurses and others are run off their feet with intense workloads, the residents get, the support to turn, etc., that they need. So it's very good if they can be attended to in the nursing home. So I am confident that we will bring more nurses, but Wyatt, the proof is in the pudding. You can bring as many as we want. If they continue to hemorrhage to other places because of Bill 124 and because of heavy workloads, then all the work is for nothing. So Bill 124 is the biggest retention hurdle that we have in Ontario, because the nursing shortage is an international crisis, is a Canada-wide crisis, but the only one that has the crisis of Bill 124 is Ontario, and hence why that has become the biggest hurdle for retention, as you likely have heard others say.
And just quickly, I want to mention something as to what you said about the health minister, Sylvia Jones. She's been invited on this program numerous times, but she's declined the invitation to come on the program. I do want to clarify something else that you mentioned in the statement, or actually RNAO President Claudette Holloway mentioned. She says, "We are glad the government now recognizes the magnitude of the nursing crisis and the central role of stakeholders like RNAO to find solutions so our health system can meet the care needs of Ontarians." Do you feel that the government of Ontario is including associations, organizations like the RNAO enough in the decision-making process to address the healthcare shortages in the province?
Absolutely, yes. The government of Ontario, past and current, are in close contact with RNAO. I spoke with the minister just a few days ago. In the Twitter yesterday, she mentioned RNAO and that we are working together. I have been consulted by Ontario Health. I have been consulted by others in government and by people at the Premier and the Minister's office. I got a full briefing before the release of the government a couple of days ago. And in our response, which they had, also there is the kudos where the kudos are deserved, and the more needs to be done. And you can see a whole paragraph on what is the more that needs to be done, which has to do with building careers for nurses in Ontario. If we build careers for nurses in Ontario, and we also work in retention of nurses with competitive compensation and with workloads that enable nurses to do the excellent work that nurses want to do, they will stay here.
And just lastly, I want to get your take on this before you go. The RNAO also mentioned in its press release yesterday that Thursday's announcement included covering registration fees to help offset the cost of accreditation for internationally educated nurses. By bringing in internationally educated nurses to the province of Ontario, how much might that be able to offset the current nursing shortages in the province of Ontario?
So first of all, we will not be bringing them in. RNAO does not believe in poaching nurses from other countries or jurisdictions that need them even more than us, perhaps, because they're even more in trouble. They are here, most of them. They are already in Canada. They want to work in Ontario. And
So just
we need
how do you
to fasten the process of registration. The $1,500 will help them, but that's not their biggest hurdle. Their biggest hurdle is not the $1,500 for those nurses, it's the slowness of processing their registration.
So then am I correct in saying that a lot of the internationally educated nurses who are already here are ready to work, but they can't?
Ready,
Yeah, but
ready to work,
exactly.
but there is what's called the College of Nurses of Ontario, which you should interview them, and why it takes them months to years to process them is very puzzling. And also we can put in touch with some of those nurses that have been waiting. I think it will be very interesting for your viewers to hear them directly.
Okay, CEO of the Registered Nurses Association of Ontario, Dr. Doris Greenspun. Thanks so much for your time today, Doris. Really appreciate it.
Thank you very much.